Hello, everyone, and welcome to the 11th Annual Touro University, California Public Health Speaker Series.
My name is Gail Cummings, Director of the Public Health Program, and I'm joined by Dr. Deirdre Wilson, Chair of the Community Action for Health Concentration. Together, we coordinate and host this series, which also serves as a course for public health students at Touro University. We're excited to have you all here today. And before we get started, we will share some housekeeping, or shall we do that after we do the intro?
We'll just go ahead and do the intro.
Well, this is an unusual opportunity that Dr. Wilson and I have today, is that we are actually sitting in the same location. We are recording today's course and series out of one of our community partners' offices right here on Mare Island, Club Stride. I'll tell you more about this wonderful organization that provides training in civic education and and broadcasting opportunities for the youth here in Vallejo. So we're really glad to be here today. So again, back to our series, we're so excited. For more than a decade, the series has brought national experts together to address the timely and complex issues affecting community health. And this year's series focuses on brings together four distinguished speakers who will explore two critical themes. First, the rise and impact of misinformation and disinformation on public health. And the second, the health experiences of newcomers in today's political climate. The title of this year's theme is Navigating Uncertainty, Public Health in the Face of Misinformation and Transition, which really does invite us to grapple with the complex realities shaping our field today. It challenges us not to only safeguard the truth and evidence in an era of widespread misinformation, but also to adapt to the ongoing social, political, and institutional transitions that are directly impacting our health today. As public health professionals, advocates, activists for humanity, we are called to sustain momentum, innovate in the face of disruption, and continue advocating for the well-being of marginalized communities and those most at risk, to ensure that their voices, needs, and human rights remain at the center of our work. I'm really excited today because we are welcoming our keynote speaker, Dr. Joseph Pierre, who is a psychiatrist and author of the book False. Hopefully for all of our students, you've had a chance to dig into this timely read. He is going to share how misinformation, mistrust, and motivated reasoning shapes health decisions and public dialogue. His work offers a critical insight into how false narratives spread and how public health can respond. But before we get started, we always want to pause and acknowledge that the city of Vallejo, right here in Mare Island specifically, which is the home of Touro University, California, we are sitting on the ancestral and unceded territory of the Confederate villages of the Lijan, the Karkin, and the Patwin peoples, who are the traditional stewards of this land. And as we reflect on tonight's theme of misinformation and its impact on health and justice, we really want to recognize that erasure and silencing have long been tools of oppression against Indigenous communities. And we really want you to think about, reflect, and take a moment to consider what this acknowledgement means for your own practice, the work that you do, or what you are studying if you're a student. How can we all contribute to truth-telling, repair, and justice in the places where we live and where we work? Thank you so much for being here this evening. We are looking forward to some exciting conversations. Before we start, we want to turn it over to Dr. Wilson.
Good evening, everyone. I have a few housekeeping items that we need to cover. So the public health program at Touro University, California offers a master's degree in public health to students seeking independent MPH degrees, as well as students seeking dual degrees in public health and medicine across 3 concentrations, including global health, community health, and our health equity and criminal justice, or criminal justice health track. of which we are currently the only accredited MPH program to focus on the impacts of mass incarceration and justice involvement as social determinants of health. So it's important that you first know that we're going to cover some course information and also that we have a Zoom recording policy. This is a virtual program, and so your participation is equivalent to consent to participate in the Zoom recording and may be used in the future. We'd like to acknowledge our 2025 Mosaic Scholars. Congratulations to Katie Burns, Annabelle Gutierrez, and Arjun Punani. And so please we welcome you as our 2025 Mosaic Scholars. I hope your colleagues reach out to you and ask you what interesting things you'll be doing with our public health speaker series this year. This is a required course, Public Health 631, and it's for all incoming independent MPH students as well as our joint MSPAS MPH students. You must attend all sessions using your unique webinar login and complete the speaker evaluations after each session. So here's a roadmap for this evening. Today's presentation is an overview of the impacts of false beliefs and disinformation. We'll have a brief Q&A session after the presentation. You may submit questions by using the Q&A function in Zoom. We also offer continuing medical education credits, and the codes will follow and will also be in the chat. Here is our continuing education information. There's an accreditation and credit designation for the Touro University College of Osteopathic Medicine. And the credit you will receive for this activity is 1.5 credits. Please take some time to use either the QR code or enter the activity code, and this must be entered within the next 15 minutes so that you'll receive credit. I will pause here for a moment, and then I will introduce Dr. Pierre. This code will also be, again, in the chat. We also offer a social justice lecture series digital badge. If you're interested in earning a digital badge for your participation in this year's social justice lecture series or any of the series from 2018 through 2014, please register at this link. I will also provide this link in the chat. And we also offer a micro-credential in our criminal justice and public health course. That will also be in the link. Now, I'd like to introduce Dr. Pierre. Dr. Pierre is a health sciences clinical professor in the Department of Psychiatry and Behavioral Sciences at the University of California, San Francisco, and the unit chief for the Langley Porter Psychiatric Hospital Adult Inpatient Unit. He has extensive clinical experience working with individuals with psychotic disorders, substance abuse, and those with dual diagnoses, as well as research experience participating as a primary investigator and collaborator for clinical trials in schizophrenia and early intervention for young persons at high risk for psychosis. His academic work explores the gray area between psychopathology and normality, with a focus on delusion-like beliefs, including conspiracy theories. Dr. Pierre has authored over 100 papers, abstracts, and book chapters related to schizophrenia, antipsychotic medications, substance-induced psychosis, delusions, and delusion-like beliefs, auditory hallucinations, and voice hearing, and a variety of other topics, including the neuroscience of free will and culturally sanctioned suicide. He is also the author of False: How Mistrust, Disinformation, and Motivated Reasoning Make Us Believe Things That Aren't True, as well as the Psych Unseen blog at Psychology Today. He serves as an expert witness consultant for forensic legal cases involving schizophrenia and the intersection of psychosis and ideological beliefs and delusion-like beliefs. Please join me and Dr. Cummings in welcoming Dr. Joseph Pierre.
All right, well, thank you so much. And I'm going to share some slides. And while I'm doing that, I want to say thank you for the invitation, particularly to Dr. Cummings and Dr. Wilson. I'm very excited to be addressing people who are going into the healthcare profession. Obviously, it's a much needed role in society, and always enjoy talking to trainees. Also had the pleasure of visiting Mare Island not too long ago, so I feel just a little bit more connected to you all. All right, but without further ado, I'm going to be talking tonight about false beliefs related to medicine or related to healthcare. And I don't have any conflicts of interest to report, but I do want to disclose that I will be talking about politics. But this is not because I have a particular partisan message or because I'm affiliated with any sort of particular party. Rather, I have to talk about politics because the subject of false beliefs about medicine has become a decidedly political topic. And so let's go ahead and start by giving you some idea of what kinds of false health beliefs I'm talking about. And so in the next several slides, I'm going to be referring primarily to poll data. We heard several years ago at the start of the pandemic, the World Health Organization warned that there was going to be a looming infodemic. And we're now 5 years into that infodemic, which I think has led to either false beliefs or at the very least considerable uncertainty about health facts. So to start with some data, this is data from a fairly recent poll in 2023 by the Kaiser Family Foundation, which is a nonprofit source of health policy research. And in this survey, they asked respondents about different false claims related to medicine. This first slide shows specifically false claims about COVID-19 and vaccines. So for example, you can see the first one there is COVID-19 vaccines have caused thousands of sudden deaths in otherwise healthy people. The second one on this list is the MMR vaccine has been proven to cause autism. The last one, more people have died from COVID-19 vaccines than have died from the COVID-19 illness. And so if you look at the first column, they first asked how many people had heard of these false beliefs. And you can see that anywhere from 40 up to 65% of respondents said that they at least heard about these claims. In the second column, you can see that the percentage who believed that those false claims were definitely or probably true was anywhere from 20 up to 34%. Now, those data happen to match a more recent Gallup poll that specifically asked, from what you've read or heard, do you personally think that certain vaccines do or do not cause autism in children, or are you unsure? So basically it's asking, do you think vaccines cause autism in children? And this Gallup poll found that 13% of US adults said yes, I do think that vaccines cause autism in children. That number is not, I think, too surprising or even alarming. What is alarming to me is that 51% were unsure. So actually, the proportion of those who did not believe that vaccines cause autism was a significant minority at only 36%. Other polls have found that as many as 25% believe the conspiracy theory that scientists and the government know that vaccines cause autism, but they mandate them for our children anyway. Now, based on that same Gallup poll, that poll has actually been given yearly over the past couple decades. So we have data going back to the early 2000s. This question asks, do you think vaccines are more dangerous than the diseases they're designed to prevent? And here, the proportion that said yes, they're more dangerous than the diseases they're designed to prevent you can see 2 decades ago was not a very large number. We're talking about 7%. And that actually held steady. And so much of what I'm going to be talking about today and what we're seeing now is a relatively new phenomenon that happens to coincide with the pandemic. So now in 2024, as many as 20% believe that vaccines are more dangerous than the diseases that they're designed to prevent. And that, of course, means 1 out of every 5 people. Going back to that Kaiser poll, they also asked about reproductive health and firearms. So they asked about specific false claims. So, for example, with regard to reproductive health, one of the questions was sex education that includes information about contraception and birth control increases the likelihood that teens will be sexually active. And as an example about firearms, the last one there, people who have firearms at home are less likely to be killed by a gun than people who do not have a firearm. So all of those are false beliefs, or false statements rather, false claims. And similar to the previous question about vaccines, we can see that 45 to 57% had at least heard about those false claims. And once again, those who actually believed it, thought it was definitely or probably true, was in the range of 30 up to 60% of respondents. Now, much of my work, academic work over the past several years has focused on conspiracy theories. So I'll touch upon that briefly. This is an older study, data from 2013. Study was published in 2014. And once again, this is poll data. This is asking about a number of specific medical conspiracy theories. First one on the list here, the FDA is deliberately preventing the public from getting natural cures for cancer and other diseases because of pressure from drug companies. Another one, the CIA is deliberately infecting large numbers of African Americans with HIV under the guise of a hepatitis inoculation program. And the last one, public water fluoridation is really just a secret way for chemical companies to dump their dangerous byproducts of phosphate mines into the environment. So how many, first column, had at least heard of these? Again, 19 to 63, similar to what we saw from the other polls. And those who actually agreed with it, anywhere from 12 to 37. So that is, in some cases, more than a substantial minority. All right, so now that we have a sense of what kinds of false health beliefs I'm going to be focusing on tonight, we can turn to the question, why is it that people believe things that aren't true? Now, as was mentioned, I have written an entire book on this subject, and it really takes the reader chapter by chapter through various psychological explanations of why we believe things that aren't true. Things like cognitive biases or heuristics or logical fallacies. And then specific examples like confirmation bias or the Dunning-Kruger effect or cognitive dissonance, the illusory truth effect, and even something called bullshit receptivity. And so all of those things, I think, can help us understand why people believe things that aren't true. And I think understanding some of those things can be particularly helpful on an individual level. They can also help us understand why it is that people often cling to those false beliefs so tenaciously. But tonight, I'm not going to go through all of those different topics. Instead, what I'm going to present is what I would argue is a kind of simpler, more universal, less pathologizing, and really more humanizing framework to understand false belief. These days, I tend to call this the 3M model. And 3M's because they are based on 3 core components, each starting with the letter M. The first is mistrust. The second is misinformation. And the third is motivated reasoning. Now, you might have noticed, for those of you who have seen my book, that the subtitle has to do with disinformation or misinformation. For some reason, the publisher didn't like the alliteration of 3 M's, and so they made me change it to disinformation. But I like the alliteration. I'm sticking with the 3M model. Okay, so let's go ahead and start with mistrust. And what I'll focus on for tonight's lecture is specifically medical mistrust. So let's again look at some poll data. The good news here is that this is a poll that asked respondents how they would rate the honesty and ethical standards of people in various professions. And this is pretty new data. This was from just early 2025, so early part of this year. And so the good news for those of us in healthcare is that relatively speaking, we belong to professions that are rated as pretty high at levels of honesty and ethical standards. So if you divide it up into these different sort of quartiles, if you will, the medical professionals, nurses in particular, do very, very well. We do better than lawyers, bankers, lobbyists, members of Congress are way down there at the bottom. So that's the good news. As you might imagine, though, there's also some bad news. Oh, sorry, this is a blow up of the good news. So nurses, 76% of respondents said that nurses had either high or very high honesty and ethical standards. Medical doctors, not quite as good, but still ahead of the rest of the pack. So what's the bad news? The bad news is that these numbers have fallen over the past 5 years, again, coinciding with the pandemic, representing a loss of 14 percentage points for medical doctors. Nurses still looking pretty good, but nurses also lost 5 percentage points. And if we look farther back over time, and if we look at the percentage of US adults who say they have a great deal of confidence in the institution of medicine, the way it's worded in this poll is whether or not you have a great deal of confidence in people running each of these institutions. So if you look at medicine, back in the 1970s, we're talking about 60% of adults had a great deal of confidence about those institutions. And you can see that at the last time this particular survey was given in 2018, that had dipped way down to 37%. We've seen a number of different sources of data that show significant declines since the pandemic. So I would guess that even though I've not seen the results of more recent surveys, that number is quite a bit lower than 37% now. And so this is going back to the Kaiser survey. This one is from the one from the beginning of 2025. This question asks, how much do you trust each of the following entities to make the right recommendations when it comes to health issues? And so what I want you to look at in this slide is the last column that I have written in red. That's the percentage who say that they either have no trust at all or not much trust in these entities. So again, good news for people like me, a doctor. Only 15% say that they have no trust or not much trust. But if we then look at institutions of healthcare in this country, and to be clear, again, this is from January of 2025, so this is presumably reflects views about these agencies during the Biden administration. 34% don't think that the NIH is trustworthy to make the right recommendations. 46% say Centers for Medicare and Medicaid are not trustworthy. FDA, 48%. So very high numbers of mistrust of those healthcare institutions. Meanwhile, they also asked poll respondents if they thought that RFK Jr. or Dr. Oz or even President Trump were trustworthy to make the right recommendations. And you can see that if you look at the proportion that did think that President Trump, for example, that people had a great deal of trust in him to make the right recommendations for health issues, that was not too far off from other institutions, like, again, the FDA or the CDC. So I think that's a very striking finding. I'll say more about that later. Now, if we pivot away from medical doctors to scientists more generally, a 2019 Gallup poll found that just under half of respondents believe that scientists are just as biased as anyone else. And they also found that 35% believe that the scientific method can be used to produce any conclusion the researcher wants. A more recent Pew poll found that over the past 4 years, about a quarter of respondents had either not too much or no confidence at all that scientists act in the best interests of the public. And almost half of those respondents believe that scientists should stay out of policy debates. All right, so that's my piece on mistrust. You can see that there is significant mistrust of healthcare institutions here in the US, of scientists, of healthcare workers, we've seen a decline. And again, we've seen a lot of this change in just the past 5 or 6 years, coinciding with the pandemic. So within my 3M model, what I will argue is that when we are mistrustful of reliable sources of information, experts or institutions of what we call epistemic authority, when we're mistrustful, we then become vulnerable to misinformation, as well as deliberate disinformation that's out there in the world. Now, I think there's general agreement that misinformation at this point in history is a major problem. Here's some poll data. This was summarized in a JAMA article from last year, saying that 86% of adults in the US say that the spread of false and inaccurate information, generally speaking, is a major problem. 3/4, 75%, said that the spread of false and inaccurate information, specifically about health issues, is a major problem. And anywhere from 68 to 78% of respondents felt that the media, as well as the government leaders, were not doing enough to limit the spread of misinformation. Now, you may have heard that information scientists have found that within the internet and within the click-based economy of the internet, misinformation and false news or fake news travels farther and faster online than reliable news. However, if you are not out there actually looking for that information, you might not be aware of just how pervasive, or maybe we could call it invasive, the health-related infodemic has become. So I'm going to give you some examples of this. This is an older study, but often quoted in the vaccine hesitancy literature. This is a study published in 2009, simply based on using Google as a search engine and using the keyword vaccination. So back in 2009, when the study was published, if you typed in vaccination to Google, 71% of the search engine hits, the results, came from anti-vaccination sites. If we look at more recent data, these are data from 2019, published in 2020. This was looking at Facebook, looking at Facebook pages that the authors divided up into either pro-vaccine or anti-vaccine sites. And what they found is represented here schematically, where the red dots are the anti-vaccine sites, the blue dots are the pro-vaccine sites, and the green dots are the sort of neutral sites. And so what this schematic shows you is that the number of anti-vaccine sites outnumbered the pro-vaccine sites 2 to 1, and the degree of interaction between the anti-vaccine group sites and the neutral sites was far more extensive than interactions with the pro-vaccine sites. If we look at data from the pandemic, this was data from 2020, looking at the 150 most viewed videos about COVID-19 on YouTube. This study found that 27.5% contained false information, and those had been viewed by over 62 million viewers worldwide. That was back in 2020. Presumably those same videos, assuming they're still up, have been viewed many, many more times at this point. And one of the most influential anti-vaccine organizations, something called the Children's Health Defense, which was chaired by RFK Jr. from 2015 up until 2023, when he threw his hat into the political arena and was running for president himself. Children's Health Defense has their own online newspaper called The Defender. And that site routinely publishes, at the very least, misleading, if not, frankly, false information. For example, earlier this year, during the outbreak of measles in Texas, that site was publicizing claims that the measles outbreak was actually caused by vaccines rather than lack of vaccination in those communities. The Defender has also published claims that new research has found that vaccines do, in fact, cause autism. Despite the fact that oftentimes when they're making those claims, they're citing retracted studies like the infamous one by Andrew Wakefield some years ago, as well as new data. And you can see on the right hand, it looks as if that's a study. It says it's peer-reviewed at the top, but this is not, in fact, a peer-reviewed journal. This is essentially a fake journal that is masquerading as the real thing. Now, if we get off of vaccines for a moment, misinformation related to healthcare is in no way limited to vaccines. It is pervasive, for example, on the subject of AIDS and HIV. For many decades, the misinformation has fueled AIDS denialism, including, for example, the belief that AIDS is not caused by the HIV virus. That has been said to have contributed to millions of deaths worldwide. If we look, for example, at oncology, this is a 2021 study that looked at 200 articles that had been posted on social media about cancer, and the study found that 33% of those articles contained misinformation and 31% of them contained harmful information. Meanwhile, echoing what we saw a couple slides back, the median number of engagements with the articles with misinformation or harmful misinformation was significantly greater than the factual or safe articles. It was mentioned that I'm a psychiatrist, so I would be remiss if I did not mention something called the Citizens Commission on Human Rights. This is a part of the Scientology organization and the CCHR, as well as Tom Cruise himself, have been telling people for many years, for decades, that psychiatric disorders don't exist, that antidepressants drive people to violence, that ECT causes brain damage, and that psychiatric care amounts to criminal torture. So that's really just a tip of the iceberg of what's out there. There's just an enormous amount of misinformation about healthcare, and we need to be aware that our patients, our communities, are exposing themselves to this. And for that matter, all of us are, right? We know that even doctors, use Google searches to look up things about medicine. All right, so the final component of my 3M model is motivated reasoning. And so if mistrust explains why it is that people discount reliable information, so in this case, information from the medical establishment, and if misinformation explains why certain other counter narratives are embraced, what we then are left to explain is why it is that some people hold these false beliefs and others don't, and why both sides hold them so tightly. And so in order to explain motivated reasoning, I'll start by saying that it goes hand in hand with a related cognitive process called confirmation bias. And this is the best illustration I've ever seen of confirmation bias in this cartoon. So in the first frame, a guy's sitting at his computer screen. He says, I've heard the rhetoric from both times. Time to do my own research on the real truth. And he gets on a search engine and he clicks on literally the first link that agrees with what you already believe. And he says, jackpot. So confirmation bias, I feel like that's sort of become a household word now, but it simply means that all of us tend to gravitate towards information that supports what we already believe, or at least want to believe, and we tend to swipe past or reject information that contradicts it. But in order to understand motivated reasoning, that is a little bit more complicated. So confirmation bias refers to what we do when we encounter information, either engaging with it or not. Motivated reasoning takes us one step further. It describes what we do when we actually engage with that information, which is similar to confirmation bias. What we typically do is that if the information conforms with our pre-existing beliefs or what we want to believe, then we typically judge that information as very high quality, as the person or the people who are putting out that information as very trustworthy and reliable. And if it contradicts what we believe, then we poo-poo it, right? We say that there's a conflict of interest, or that the person's not reliable, or that the data is flawed in some kind of way. So it's more than anything, it's motivated reasoning that explains why, for example, an anti-vaxxer thinks that RFK Jr. is very reliable, or why the Children's Defense Fund newspaper or online newspaper is very reliable, and then conversely why something like the CDC is not. And then conversely also, for those who are so-called pro-vaccine, why they think exactly the opposite. And motivated reasoning also helps explain why people can hold such strong beliefs, even based on very flimsy evidence or even a lone dissenting opinion. In this cartoon, the man's saying, if P is false, I'll be sad. I don't wish to be sad, therefore P is true. So that's kind of an illustration of motivated reasoning. It has been claimed that motivated reasoning is what could be characterized as identity protective cognition. And in this case, what that means is that essentially what it means is that when we engage in motivated reasoning, we're engaging in a cognitive process that allows us to never have to admit that we're wrong. And motivated reasoning also specifically refers to not just our own individual belief, but our affiliated beliefs. So the beliefs of our affiliated groups or our tribes or our political parties and that sort of thing. And so when we talk about identity protective cognition, it's not just talking about protecting individual identity, it's talking about protecting our ideological group identity. And so, indeed, in 2025, one of the best predictors of the kinds of false beliefs about healthcare that I'm talking about tonight is not age, it's not gender, it's not ethnicity, it's not even level of education. It is political affiliation. So, if we go back and look at those same polls that I was spent the first half of the talk talking about, we now look at the breakdown of endorsement between those identifying as Republican versus Democrats. So this is the question about reproductive health. Republicans were 1.5 to 2 times as likely to believe that birth control makes it harder to get pregnant after it's discontinued, or that sex education increases the likelihood that teens will be sexually active. Those identifying as Republicans were also twice as likely to have false beliefs about firearm safety. Compared to those identifying as Democrats, they were 2 to 3 times more likely to believe misinformation about COVID-19. This is separate data, but they are twice as likely than Democrats to believe that vaccines cause autism. One poll actually found as much as a 5-fold difference in belief in autism, where Republicans are much more likely than Democrats to believe that connection. Similarly, there is a 2-fold greater belief between Republicans and Democrats about whether or not the COVID-19 vaccine is more deadly than the virus, with the gap expanding to about a 3-fold difference earlier this year. And again, if we look at those same kind of questions going back a couple decades, we can see that this idea that vaccines are more dangerous than the diseases that are designed to prevent, the partisan split is relatively new. Back to 2000 up until 2019, there was actually general agreement. What we've seen is this split just in the past 5 years, where now it's Republicans that are much more likely to believe that vaccines are more dangerous than the diseases that are designed to prevent. And accordingly, only about 26% of Republicans believe that it's extremely important to vaccinate children compared to 63% of Democrats. Okay, so although it's often claimed that the reason for this partisan split is stupidity or anti-intellectualism or idiocracy, a variety of other pejorative terms, I think that conceptualization is off the mark. It's off the mark because I don't think it's accurate, and it's certainly, I don't think, is not a helpful way to think of things to address the problem. So to be clear, when people who identify as Republicans embrace false health beliefs, it's not because they're stupid, no matter how many times we hear that claim. What is it? Well, I would argue that the answer lies in my 3M model. It's related to mistrust, misinformation, and motivated reasoning. So, for example, if we look at the poll question about trust in doctors, we can see that 2 decades ago, it was actually Republicans who were a little bit more likely to be confident in the accuracy of medical advice for their doctors. We can see that that has flipped in more recent years. Now, this is not a huge difference. I will concede that. But if you look at the flip, it does represent a 20% swing. Likewise, if we look at that recent poll that asks about the honesty and ethical standards, Republicans were 20% less likely than Democrats to rate doctors as having very high or high honesty and ethical standards. And again, keeping in mind that this poll reflects the healthcare administration during the Biden years, Republicans were far less likely than Democrats to trust in health agencies like the NIH, the CDC, the FDA, and they were actually much more likely to trust RFK, Dr. Oz, and Dr. Trump for healthcare recommendations. This is a recent study published earlier this year that looked at the effect of political ideology on trust in scientists of various types. This is a US study. And it found that conservative political ideology was associated with less trust compared to liberal ideology across 50 different types of scientists. And the ideological effect was most pronounced in these 10 scientists. So climate science, number one, but virologist, number three, sociologist, number five, psychologist, number seven, epidemiologists, and medical researchers there in the top 10 as well. And if we move on from mistrust and think a little bit about misinformation, this was the KFF, the Kaiser poll that asks about COVID-19 false beliefs, reproductive and firearm false beliefs. And we can see that there was a significantly greater rate of false belief for people who used Fox News, Newsmax, and OANN as who rated those as reliable sources of news information. And those, of course, are conservative, ideologically conservative news sources. So in the final part of this talk, I am going to kind of take a quick whirlwind tour through a number of recent US policy decisions affecting healthcare, because I want to try to draw a connection between how the kinds of false beliefs that I've been discussing tonight have been used to drive and justify public health policies, and despite their harmful consequences, why we aren't hearing as much opposition to these policies from those on the political right. And so there's a kind of underlying assumption here that beliefs are associated with actions and have consequences. So we do know from research that there are a number of consequences of false health beliefs, and that includes less healthy behaviors, including things like avoiding medical care or using alternative therapies in place of conventional medical treatment. We know also that there's a reciprocal relationship with trust and false beliefs, so that these false healthcare beliefs lead to more mistrust, just as mistrust leads to false health beliefs. So it is a kind of vicious cycle. And the point I'm going to try to make now is, again, that I would argue that some of these false health beliefs are associated, therefore, with support for public policies that actually undermine healthcare. And so if we look at infectious disease, false beliefs have led to, or I shouldn't say have led, have been temporarily associated with growing vaccine hesitancy, and the rates of parents who think it's important to vaccinate their kids have dropped to their lowest point in the past 25 years. If we look at the number of US kindergartens who are actually vaccinated against a number of different childhood illnesses, the vaccination rate has dipped below the federal target of 95% that has been shown to reduce outbreaks. This is a recently published JAMA study that found that only 35 to 40% of US parents of young children or pregnant parents intended to fully vaccinate their children, 35 to 40%. And so it should come as no surprise then that we're in the midst of the largest outbreak of measles in over 30 years. We've seen more cases in 2025 than we've seen since 1992. And it should come as no surprise that that kind of vaccine hesitancy has led some individuals to embrace unconventional and ineffective strategies for health prevention, like the use of cod liver oil to prevent measles. And that should remind us of what happened during the COVID-19 pandemic, where rates of hydroxychloroquine and ivermectin increased up to tenfold, estimated to have cost some $272 million. And if you look at those who were using hydroxychloroquine and ivermectin for COVID, those who did that were associated with belief in COVID-19 related misinformation, lower trust in hospitals, physicians, and scientists, as well as greater belief in conspiracy theories. Now, beyond individual behavior, like getting vaccinated and that sort of thing, Again, what I'm going to argue is that false beliefs also affect public policy legislation, as well as support for or lack of opposition to those policies. And of course, what we've seen this past year is significant budget cuts again across a variety of different government programs that support health here in the US as well as abroad. We've seen mass layoffs within the Department of Health and Human Services. It was estimated that there might be as many as 20,000 jobs cut from the likes of the FDA, the CDC, and the NIH, amounting to a quarter of the DHS workforce. I worked for the VA for many years, left there about 2-3 years ago, and I often, when I read the news of the past year, I felt like, I got out at the right time, because it was said that when Elon Musk was running Doge, that there were going to be 83,000 VA employees that were going to be fired. Then, of course, what we've seen this past summer are significant, drastic cuts to biomedical research funding. We've seen retaliatory cuts to university research funding, including at my alma mater in UCLA not too long ago. We've seen RFK Jr. Axe vaccine developments. We saw the limitation where it looks like coming into the winter season here, the flu season, that COVID-19 vaccines are going to be limited to only the elderly or high-risk groups, and that you might need a doctor's letter to prove that you're in a high-risk group. We've seen states like Florida who have taken steps to remove school vaccine mandates. Other states are said to have been lining up to do so as well. Recently, RFK Jr. pulled $50 million, $500 million in funding for mRNA vaccines. And then we saw various shakeups within the DHS agency leadership. So Peter Marks, one of the veterans of the agency in charge of vaccines, stepped down. Just back in June, we saw that the entire membership of the independent CDC's Advisory Committee on Immunization Practices, known as ACIP, was replaced by a group of handpicked individuals by RFK Jr., who many of whom would be, I think, fairly characterized as anti-vaxxers. And then shortly thereafter, medical organizations like the AMA or the American Academy of Pediatrics, who for many, many years were invited to participate as non-voting members to that advisory committee, were barred from participation. Just recently, the newly appointed CDC chief was fired, followed by resignation of 4 different top officials who went on public record saying that they felt they could not credibly work under the anti-vaccine agenda of RFK Jr. And if we go back to reproductive health and psychiatry, just 2 months ago in July, the FDA recently hosted a who's who of psychiatry's critics to discuss the use of antidepressants in pregnancy. That committee made claims about SSRIs, antidepressants, causing autism, miscarriages, birth defects. And it was said that they were considering a black box warning for antidepressants in pregnancy. Needless to say, organizations like the American College of Obstetricians and Gynecologists called those claims unsubstantiated and inaccurate. They cited robust evidence that SSRIs are in fact safe in pregnancy, and they highlighted the very real risks of untreated depression among pregnant women. All right, well, that's my whirlwind tour through public policy. I'm going to now finish up by talking about the million-dollar question: what, if anything, can we do about this? And so I'm going to once again return to my 3M model and argue that when we think about interventions, we can think about them along the lines of mistrust, misinformation, and motivated reasoning. So mistrust, we know is an issue. And we, as healthcare providers and healthcare institutions, have to do a better job of earning trust or regaining trust. And generally speaking, I would argue that we do that one does that through transparency, public engagement, and collaboration. We have to do a better job of winning the war on misinformation. some of the data that I've shown tonight, like thinking back to the one about the Facebook groups and the vaccine sites, we are losing the war on excuse me, we're losing the war on misinformation, particularly in arenas like online spaces, social media, that sort of thing. And then motivated reasoning. I think we have to keep in mind that political ideology is predictive of some of these false health beliefs, and we have to understand what drives that motivation and how we might try to do something about it. So more specifically, what can we do? Well, I'll start with individuals as individual healthcare providers. Again, number one, it starts with strengthening trust with our patients, by fostering relationships, by spending time with our patients, by sharing stories with them about what we go through. But people often forget that doctors and other health care providers are also patients, right? So it's not just that we are these fundamentally different people. We share a lot of experiences. So I think a lot of that is important for fostering trust. I think it's important to hone our skills as educators and storytellers. We have to be able to tell a good story that captures people. We can't just be quoting statistics and hard facts. We have to appeal to not only facts but also values. Values I define as beliefs about what's important. So if I'm a pediatrician speaking to a young couple who had a baby and they're thinking about vaccines, I want to appeal to their value, the value of, I know that you want to do what's best to protect your child. And so then I can say, well, as a physician, here's what I think is the best thing you could do to protect your child. Okay, so that's a values. This next one I think is key in this day and age. Discuss and recommend trusted informational sources. We have to understand that our patients are not getting their information from the same places we are necessarily. And so you want to have conversations about that. Where do you get your health information? What do you trust for information? Thinking back to the slide about people trusting President Trump and Dr. Oz as more reliable than the CDC. You really, I think, have to know the counter narratives. You have to know the misinformation that's out there to combat it. And in doing so, one of the most evidence-based interventions is what we call pre-bunking as opposed to debunking. Another term for this are inoculation strategies. We want to address misinformation before it gets into people's heads. So we want to bring up things. So again, if I'm the pediatrician talking to a young couple about vaccination, I might say, hey, you may have heard something about Tylenol and pregnancy. Well, let's talk about that. And here's what I know about that subject. So that then when they read it in the news, they say, aha, I remember my doctor telling me about this. So we want to beat misinformation to the punch. Okay, so that's what healthcare providers can do. What about healthcare systems? So once again, number one, cultivate trust. Number two, education. I think we, again, can do a better job of education. I think we really have to do a better job of being in spaces where people are sharing information, which, of course, in this day and age means social media, online, TikTok, that sort of thing. Those aren't really traditional places where physicians, spend their time, but I think it's very important to be in those spaces. Expanding access and accessibility. We know, for example, that for vaccine hesitancy, regardless of what people do or do not believe, one of the best ways to increase vaccination rates are to set up walk-in clinics so that it's just easier for people to get vaccinated. I have participated in some community events with hospitals, particularly during the pandemic, where they engaged with the public, invited people to come in and share concerns they had about the pandemic, ask questions about masking, ask questions about vaccines, and really have a dialogue. So that goes back to what I said earlier about being accessible, transparent, and really engaging. I think in psychiatry, we often use what we call peer counselors, people who have had mental health experiences themselves to engage with other patients. Because again, sometimes that might be a more trusted source of information, people who have shared experience. For that matter, I'll don't have a bullet point here, but I'll mention that I think it is very important to have healthcare providers, physicians, nurses, what have you, nurse practitioners, physicians assistants who look like their patients and come from communities where their patients are, right? We know that that's a very important way to foster trust. And I think we can use false beliefs as quality measures. So as a healthcare system, you could try to implement some of these interventions, and you could then track to see whether or not they're having an impact. Okay, in the very final slides here, I'm going to just leave you with some other sources of information if you want to pursue these topics in greater detail. So this is just a little review article from 2019 that summarizes with some references many of the things I've talked about today in terms of how we can counteract medical misinformation. If you're interested specifically in vaccine hesitancy and that subject, this is a site called JitsuVax. The idea is sort of like using jujitsu techniques to interact with people and, taking their energy and sort of pivoting it. And the philosophy here includes understanding what these researchers call attitude roots that underlie why people reject scientific consensus about vaccines. For them, attitude roots include things like beliefs or ideologies, fears or identity issues, much of which overlaps with what I've said tonight. This is a site I particularly like called MisinfoRx, and they offer this thing called a toolkit for healthcare providers. I think it's a very practical, easy read about what we can do to improve our interactions with patients. They recommend something called the 3 C's approach based on collaboration, connection, and compassionate understanding. I particularly like that they have these sort of case studies that allow you to simulate conversations with patients and engage in role plays. As a physician working in the hospital, I'm constantly having to do one training or another. I have to train about infection control or fire safety or, sexual harassment. And all those things are worthwhile. But I would love to see more hospital-wide training in how to interact with our communities on misinformation. So I think this is a great resource for that. This was put out in 2021. This is by the US Surgeon General, something called Confronting Health Misinformation. This goes through some of the things I mentioned just a moment ago about what health professionals can do as well as what health organizations can do. I think it's a very nice resource. I have to say, though, that I'm surprised it's still available online, and I'm a little bit concerned that it's going to disappear off the Surgeon General's website. So get it while you can. And 2 more slides. This is from the APA, the American Psychological Association. This is a consensus statement called Using Psychological Science to Understand and Fight Health Misinformation. This, again, touches on some of the things I presented tonight. Also goes through in much greater detail what I said about inoculation strategies and pre-bunking, which, again, is one of the most evidence-based interventions. And finally, I will mention my book. I know some of you have had a chance to read some of the chapters, so I appreciate that. And although my book doesn't focus on healthcare or medicine per se, many of the topics that I cover there are still pertinent to the work we do as healthcare providers. And that is my last slide, so I'll end there. And I know we're planning to have some Q&A, so thank you.
Here we are. Well, thank you so much, Dr. Pierre. That was a really riveting discussion, very stressful for many of us as we note the timeliness of this conversation as well as all of the research that you've supported. There are a number of things coming through, a number of comments coming through the chat. We have questions. Dr. Wilson and I both have questions for you, but I would like to give our students an opportunity and participants on the call to put their questions in the Q&A box, and we will make sure to summarize some of these questions for you. So those of you who are putting comments in the chat, these comments, Dr. Pierre, are really for your eyes. They're thanking you for the presentation. And I'm going to go ahead and share some of the questions that we have here in the Q&A. This is from Andrea Yee, I'm sorry. Would you be willing to share your thoughts on Trump's announcement this week that it is unsafe for pregnant women to avoid taking an acetaminophen? Did I say it correctly? We know he had difficulty.
Yeah.
What do you
Tylenol,
think are the
right?
consequences?
Well, I almost included some slides on that at the last minute, but it's actually a really good example because, and it sort of gets at motivated reasoning because I must say when I first read it, my reaction was essentially, this is ridiculous. Why are they doing this? This can't be true. But I did look at the literature on this subject, and I will say that there are some studies that have raised concerns about acetaminophen and not just autism, but various developmental issues related to pregnancy. Now, if you look at consensus, again, from organizations like the American College of Obstetricians and Gynecologists or that sort of thing, what they are saying is, look, if you look at the fair balance of the research and you look at the higher quality studies that have been controlled for other factors, they have found that there is no significant risk associated with acetaminophen or Tylenol in pregnancy. And this is similar to what we see with vaccines or what we see, there are some published studies, including the one that was retracted by Andrew Wakefield, that claim that there's an association with autism and vaccine. So this is kind of what happens, right? Is that people sometimes with a particular agenda and a message will grab onto like one little piece of information then to make this greater claim. In my book, I talk about climate change a lot in that same way. We're often told that 97, 99% of climate change scientists agree that climate change is a reality and it's a threat, and that's true. But those who disagree with that will go ahead and they'll find the one study out of that 100 that contradict that, or they'll find some Nobel Prize winner who had no expertise in climate change but still won a Nobel Prize who says climate change is a hoax. So that's the challenge, and I think for us as healthcare workers and providers and teachers and all of that, you do have to be discerning. And this is off topic for tonight, but some of my very recent work is focusing a little bit on AI. We cannot accept the easy answer, right? You can't just ask, does Tylenol cause, autism and type that into Google or ChatGPT. That's not a good way to get information. When I'm trying to answer a clinical question treating one of my patients, I do it the old-fashioned way. I do a PubMed search. I look up sometimes 20, sometimes 40 articles, and I pour through them. And I look through them and I decide, okay, well, this one says this one says, how do I resolve that? I mean, that's what so-called experts do, right? And that's why all of us do have to rely on expertise, right? We don't know everything about anything. We have to rely on experts. So anyway, it's a long-winded answer. So I think the fair balance answer on that subject is that the preponderance of evidence does indicate that the use of acetaminophen is safe in pregnancy. And similar to what we said about SSRIs in pregnancy, what the present administration didn't address is like, what's the risk of untreated fever in pregnancy, right? Like there's risk and benefit. You can't just, say, oh, there's this one study that showed such and such. You got to look at the big picture. Meanwhile, pain in pregnancy is vastly undertreated, both during pregnancy, during delivery, like across the board. There seems to be this sort of odd cultural idea that women should just put up with pain. And meanwhile, we know that non-steroidal anti-inflammatories are really not recommended in pregnancy. So if we're not using Tylenol or acetaminophen, like what are women supposed to do? Like nothing, like tough it out. So it's a very complicated subject. It's relatively new, this claim. It's not based on zero evidence. There is some evidence out there, and you really have to kind of do a deep dive to really understand the topic in greater detail.
Yeah, no, I really appreciate that answer, and what I'm picking up and thinking about, reflecting on from that answer that you just provided is, yeah, there's no short answer. You know, we are no longer critical thinkers, and so we want to get to that shortcut. And I think as there's another question in the chat about kind of the follow-up from the same question about using transparency. So, you know, the conversation you just had with us and answering that question, that's the conversation that needs to be shared, and making sure that we also respect people's capabilities to be discerning as well. And I think that's kind of what you're kind of pointing out.
Hmm. Hmm.
You know, and I know this is, you know, when you went through sort of what can clinicians do to kind of combat this misinformation, you talked about pre-bunking. And I'm wondering, alongside of pre-bunking, would you also include sort of empathizing with patients and communities who do have these different beliefs that are grounded in a lot of things for a lot of reasons that are reasonable for them to think about.
Yeah, I mean, I definitely go into that in the book where I make the point and didn't emphasize it so much tonight. But, you know, when I say the 3M model and when I claim that it is, you know, not pathologizing and it's sort of more humanizing, I think we do often run into this mistake of saying, oh, people believe these things again because they're stupid or they're not educated or this kind of thing. So to be clear, mistrust, that's not a pathology necessarily, right? Now, I happen to treat patients who have, you know, paranoid psychosis, and so sometimes their mistrust is pathological. But at the same time, mistrust is often completely legitimate and earned, right? Like the healthcare industry is not perfect. There are certainly cases of conflicts of interest, of corruption, of scandal. You know, the list goes on. And so we have to understand that sometimes when people are mistrustful, we have to kind of own that, you know, as a larger healthcare profession. And that's why I place so much emphasis on the gaining back of mistrust, the establishing mistrust. And so, as you suggest, how do you do that? Well, this is just like in psychotherapy. You do that by getting to know someone and listening to them compassionately, right? Not saying, well, you know, people always ask me, Dr. Pierre, what should I do when I'm trying to engage with, you know, crazy Uncle Freddie at Thanksgiving dinner and his beliefs? And I'm like, well, what do you mean engage with him? Like, what are you trying to achieve? And they're like, well, I want him like to change his mind and see that he's like talking about stuff that's ridiculous. And I always say, look, if that's your agenda off the bat, you're going to lose, right? You can't start with, I want to change people's minds, you know, sit here and debate me. Like we're just not going to get anywhere that you start by understanding. You start by listening. And then when you have that trusting relationship, that's when you can start to raise concerns or, you know, say, hey, you know, I'm wondering why you think this, because, you know, here's what I know or here's what I read. And then you can have more productive dialogues with people.
Yeah, no, thank you. We have another question here from Evan Hermel, Turo's own. How do we deal with misinformation that come from clinicians who are grifters like Joe Mercola?
Yes, well, he is mentioned in my book, indeed. Um, Gosh, well, you know, I think again, the real challenge is how do we deal with misinformation across the board, no matter who it's coming from? You know, how do you deal with it when it's coming from the president? How do you, I mean, you know, the real, you know, crazy thing now is just how much everything is turned on its head for, you know, a decade now since I've been doing this work. When I talk about mistrust, I often talk about mistrust of institutions of authority. But now, the institutions of authority seem to be the ones that ought to be mistrust. I mean, we really are, it's like bizarro world now. So whether it's
Yeah.
Mercola or the current president or RFK Jr., you know, how do you deal with that? You deal with that again by trying to understand why people do trust those informational sources, trying to explain where you're coming from, you know, and if you are a healthcare provider, you know, talking about that and the sources of information that you trust, taking people through it and really just trying to engage with them. Now, you know, when it comes to the grifters like Mercola, you know, there's an irony, right, where people who are, you know, so-called conspiracy theorists often say, you know, follow the money, right? But it's funny because they often don't follow, like, follow their own advice. Like Mercola is like a billionaire, or certainly many, many millions of dollars. And so he's grifting in the sense that he profits from fostering distrust. But then at the same time, he's saying, "Oh, but trust me and buy my supplements and buy all my other, ridiculous stuff." So that's sort of the concept of jujitsu vaccine stuff. It's like you take this idea of yeah, let's follow the money. Like, let's see who's funding the anti-vaccine movement. Let's see how Merkel is making his money. Let's look at how Alex Jones makes his money. So that's one way that you can address that.
No, yeah, thank you. Dr. Wilson, would you like to take this next one or shall I continue? Okay. We have another question. This is from Will Young. He's asking, what can we do to combat states, like Florida, with immunizations and travel there? So,
To combat states. Well, I mean, I don't know. My flip answer is to maybe not travel to Florida. uh, Gosh, look, I mean, this is CME talk, and I warned you that I would talk about politics. I don't want to get too thick into the weeds of politics, but again, I think this is a political topic. So I think we have a responsibility nationally, on the state level, on the city level, to be active. And I think we have to speak up against things like this. And I think if we're talking about healthcare, then physicians and nurses and nurse practitioners and all kinds of health providers have to speak up about this. So if I was in Florida, yes, you gotta say something. You have to be, I think, active. I think that it's probably couldn't be more true in my lifetime than the present moment. I was not born in the 60s, but now here we are in 2025. Like, you got to figure out something to do. Whether it's political activism, writing an op-ed, talking to your family members. The list goes on. We all there's something all of us can do, and you have to figure out what works for you. Now, how to specifically fight Florida from out here in California, yeah, I'm less certain about that.
yeah, I know, but that this is so true, just kind of piggybacking on, demonizing people who maybe hold these false beliefs obviously doesn't help matters. So to your point, the storytelling and the listening, I just find that really such a almost a beautiful way to think about this because storytelling has become obviously something that people are using just for their own healing from traumatic circumstances. So just to think about it also as a strategy for how we kind of build community again, I think that's so it's one of those things that's obvious. We should get to know people, in an authentic way as a way to break down this political divide, as you call it, because it's the statistics that you shared were pretty astonishing to me that there's such a difference in
Yeah.
terms of what people believe based on their political designation.
Yeah. And again, it's a
The change,
relatively
you can
new
see when that
phenomenon.
changed.
Right. And that tells you that it's not because some people are stupid or some such thing, right? This is really has to do with what's happening on a larger, political scale.
Sure. We'll take the next. We have a few other questions.
We have a couple more questions. So you mentioned in your presentation the proliferation of AI, not only used in diagnoses, but people searching, in our search engines, right? And what do you think, we can do to combat the proliferation of AI in promoting misinformation, medical information, and eroding patient trust?
Yeah, such a great question. Whether it's the internet or AI, look, I'm not going to get up here and say, that's evil and like, the sky is falling. Like, yeah, I think I mentioned in my book, I could have never written my book if I didn't have the internet. I couldn't have just gone to the library and, found all, I've hundreds of references in that book. There's just no way I would have ever done it. So I don't want to be here and say, AI is bad, the internet's bad. It's not that it's bad, it's a new technology. And I think more than anything, we, meaning as a society and as people who use this technology, we have to understand it. And we have to understand what it's good for and what it's potentially not good for or even harmful for. So, AI across the board, I don't think is a bad thing. I think there's certain applications. You're at a meeting, you have a committee meeting and you've got the AI, and at the end of the meeting, you say, "Hey, AI, write the minutes of the meeting." I mean, that's great. Then somebody doesn't have to do that. But if we're using these things, whether it's a Google search or a chatbot, to get answers about what's true or not, that's where you have to understand what the technology is doing. It's not, despite AI, it's not intelligent, it's not thinking, it's not doing what I said before, which is looking at all the different sources of information and figuring out like these ones are really the reliable ones that answer the question, and perhaps we should, weight the information from these ones less. AI, Google, all of that suffers from, in computer nerd speak, it's called GIGO. It's garbage in, garbage out. So if there's garbage out there, it's just going to churn out this garbage. And we've read these headlines, right? The ChatGPT told people to put glue on pizza so that like the cheese sticks better. There was recently published a case of someone who, at the advice of ChatGPT, stopped having table salt, sodium chloride, instead used sodium bromide, which is highly neurotoxic, and developed a psychotic syndrome in that setting. So look, that's not what these technologies are good for. There are great applications that probably will revolutionize, many different industries. But right now, the state of these products is that they're not reliable sources of information. And we have to help spread that message, not just to our patients, but ourselves. Like, I think fundamentally people just think, ooh, this is such a great way. I'll just ask Siri or I'll ask ChatGPT and that's my answer. And that's just very unreliable and fundamentally misunderstands how those answers get churned out. When we talk about AI chatbots, all they're really doing is using, what they call predictive or generative text. So they're giving plausible answers based on, reams and millions of bits of data and text. But what's in those data and text? Well, includes things like Reddit chats, social media chat. Like, this isn't a PubMed search. So anyway, so you just have to be really careful, and I think we have to be better consumers. We have to be able to use this new technology in a responsible and safe way. And I will say, while we're talking politics, that I think there is absolutely a role for government regulation, the same way there is for firearms or, whatever else. And unfortunately, what we've seen is that this current administration recently published something called the AI Action Plan, where they're calling, we need to win the arms race, the race for dominance in AI. And the way to do that is by deregulation. It's like, no, like deregulation is not the answer here.
Yeah, thank you for that. That was actually my next question about regulation. And so, and there's so many areas where I think AI can be regulated in order to control some of this misinformation. We had a previous speaker who talked about the political determinants of health. And you may be aware of this particular author. And I'm wondering, when we look at kind of the political motivations of mis or disinformation, how do you see that this political motivation, how can we stop this engine or interrupt the political motivation behind mis and disinformation? I think that is going to be a key in order for us to promote kind of a uniform, not only regulation, but to slow down this engine of misinformation.
Yeah, well, I mean, that's literally the billion-dollar question, right? Getting back to politics. And so the best I can do is just echo sort of what I said before, which is I certainly think there are things we can all do. I mean, let me start there. Part of it's just being informed, right? And part of the challenge, I think back in December, I wrote some piece called, how to maintain your mental health under threat of autocracy. And so like number one on that is you got to balance, like you can't like doom scroll, right, and get too depressed, but you also have to stay informed. You have to find what balance is right for you. But I think you do have to stay informed. Number two, I think you need to figure out what you can do, right? I think it's too easy to say, look, I can't do anything. That it's just the machinery is moving forward despite, everything. In the Georgia, not the U.S. state, but the I guess I forget if it's in Europe or Asia, but one of the Caucasus, they have been protesting against an authoritarian regime every single day since the regime took root. So people go to work and they take to the streets at night and they march. So there's a lot more we could all be doing politically. And again, I'm not trying to make this a political thing, but again, if we're talking about the kinds of policy decisions that are made about healthcare, I think that we have a responsibility to protest against that. And protest sometimes might involve, joining a march. It might involve, again, writing an op-ed. It might involve, calling out to your political leaders. I mean, the list goes on. There is a blueprint for that. And part of it is just, I think, really figuring out what you can do. Maybe it's, donating money, who knows? So I think there's something we can all do. But, it's tough. And I think the toughest thing is how to not get demoralized and feel like, there's nothing we can do. So that's the best I can say. Do you have any other ideas? I'd
You
love to
know,
hear.
I don't. I think that, when we did discuss the political determinants, and how those determinants are deeply rooted in our country and are actually moving kind of the decline of the health of the US population. One of the suggestions that was made was to really determine, what are the motivations of the other side, the other opinion, and to appeal to not necessarily our medical knowledge, but just appeal to their understanding and try to seek understanding of the other side so that you can come to some kind of common ground. And so, that is quite curious, because when you have an increase in the number of individuals with, let's say, measles, and what comes next is the increase in the number of deaths or disability, how can you find some common ground with those who have either been misinformed, or who have just a different opinion of what fact or truth is. And so you did make a statement is, appealing to the values of individuals. So I think we can all value kind of the health of our children, and perhaps that's a starting point, kind of finding like values. So I think that's the only thing that I would suggest to combat and to find some middle ground, this
Yeah.
misinformation. We do have a couple
I'll,
more
I'll just make a
questions.
quick plug for a book of that a colleague wrote a couple of years back at this point, and really sort of informed some of my understanding of some of these issues. The colleague is Jonathan Metzl. He's a psychiatrist. He wrote a book some years ago called Dying of Whiteness. And what he does is he covers different um, policies, like about education or about healthcare or about firearm ownership. And what it demonstrates is how people supporting things like not gun control or, not funding public schools is actually damaging the communities that are in favor of those policies, right? So that's the dying of whiteness, right there. And again, it's an illustration of the motivated reasoning, that they're so caught up in the, this is what I should be thinking, this is what the party says, that they're actually damaging their own communities. And I wish that there was a way then to reach people in those communities by bringing that to light. Back to the idea about Florida. I mean, I don't think that's going to end well for Florida, you know? And so either now we can talk about that, or, maybe it is going to take something to happen where you kind of go like, look, not we told you so, but, you know, but it's very difficult because motivated reasoning is so tough, and then people, again, they don't want to admit that they're wrong. So they just say, oh, no, I don't believe it. It's not true that more, COVID deaths happened in conservative states, except that it is true, you know? So very, very difficult. Uh-oh, I think you got muted, or at least I can't hear you.
Sorry, can you hear me now?
Yes, yes.
Um, Apologies for
Hmm.
the echo. I think we have time for one more question. And let's see. This person is saying that they remember back in 2009 with the swine flu pandemic, the anti-vax mentality declined quite a bit. Do you think it will take a large number of people dying from measles or even polio to radically change people's minds? It's kind of touched on that a little bit, but
Yeah, I mean, I
maybe you
wish.
can
I
elaborate.
I wish, but COVID-19 didn't do it. So I don't know. I mean, we're living in a very, very strange and curious time. I mean, that all said, I'll make one final political comment, I guess it could go back to the question of, what can you do? When all of this was happening, during Trump 1.0, and then, even during the Biden years, I heard so many people saying like, oh, well, this, meaning what's happening now, that's never going to happen, you know? And around that time, I started reading up on the history of authoritarian movements. I mean, the reality actually is that if you look over history, most democratic societies have failed. And if you look over the past century, there's countless examples of authoritarian regimes replacing democracies. So anyway, part of me, is sort of bracing for, this may get worse before it gets better, number one. Number two, even though this, I think, is fairly unprecedented in US history, is not unprecedented in the planet. And we have seen cases where democracies prevailed in the wake of authoritarian movements. So again, I think that we can look to history to find out what has been successful previously, to figure out how do we address this piece now, and misinformation and authoritarianism almost always are intertwined, in these movements. So there is a way out of that.
Okay, and I think that that will be our last question. Dr. Pierre, this has been really a riveting discussion, and I see from the chat and the questions that we have in the Q&A, so many people have appreciated listening to this conversation, but more importantly, hearing that there's something that we can do, where we don't need to be demoralized, as you note, and there are a number of strategies, community-based as well as practitioner-based, that we can lean into. And so we appreciate you pointing those out. We will be continuing our conversation with you in our podcast right after we close our webinar. So for those of you who would like to hear more, we'll make sure that we share our podcast link with you, Socially Just, to get more insight from Dr. Pierre in this conversation. We'll continue. Thank you all for joining us today.
Thank you so much. Have a good evening.
Good night.